Good morning and welcome to Joy News Desk live from our studios here at Kokomlele in Accra. We're coming to you live on DSTV channel 421 and GoTV channel 144, live around the world on myjoyonline.com. My name is Samuel Kojo. Now, coming up in this bulletin, now for doctors in Wild West, use mobile phone torch to perform surgeries 2 years after theater lamps broke down. Anxiety among toll workers union as government prepares to reintroduce collection of tolls on selected roads and bridges across the country. We'll tell you or hear from some of the workers and what they make of the reintroduction. We'll also tell you how farmers in part of the Ashanti region are using weather information from the Ghana Meteorological Agency to avoid losses on the farm. More in this week's edition of Climate Focus. In Ghana Man series today, the spotlight is on the unique community called Zoliba in the Upper East region, where a mahogany tree plays a key role. Also in this bulletin, the Chief Executive Officer of Multimedia Group, Kwesi Chum, and other trustees of Ghana COVID-19 Private Sector Fund honored for their contribution towards the fight against the pandemic. Now, for almost 2 years, the lamps at the theater at the Wild West Hospital has broken down. As a result, doctors are forced to combine 2 or 3 mobile phone torches of nurses to help them perform surgeries on patients. Now, the situation, according to medical superintendent of the Wild West District Hospital, Dr. Benjamin Ameyori, is impeding work at the theater and thus greatly affect care at the hospital. Joy News' Upper West Regional correspondent Rafik Salam has more in this report.
Among the plethora of challenges by the Wild West District Hospital is the lack of a theater lamp. The theater lamp for 2 years has broken down. They have made several attempts to repair it, but has not yielded the desired results. The Wild West District Hospital serves a district population of 98,901 and beyond the boundaries of the country because of the district's proximity to neighboring Burkina Faso and La Côte d'Ivoire. Medical Superintendent of the Wild West District Hospital, Dr. Benjamin Ameyori, says the lack of a theater lamp is greatly affecting healthcare delivery at the theater.
Permit me to say that it's only one that we have. Ideally, we should have had an overhead one and then a standing one. But we've had a standing one for the years now, and unfortunately that only one that we had also broke down. It's really affecting service because the lamp is the second eye for us, for both the nurses and the doctors when you are doing an operation. You have your own eyes, but when you are operating and you go into a cavity, a body cavity, you will not be able to see clearly. And it's like walking in the night without a torchlight. You would see that the movement will be difficult. In the same way, navigating our way through the surgical procedures that we do is a bit challenging, but we've had to do without them for close to 7 to 8 months now.
How is he able to perform surgeries without a theater lamp?
There are times you would have to ask 2 or 3 people to help with their lives. Let me just give you an example. Just this Monday, we had a man who came in with a gastric perforation with peritonitis. In layman terms, a hole in the stomach. And we needed to close the hole to avoid the contents from the stomach from leaking out into the entire cavity. And I had to use 2 lights, one on one side and another on another side, phone lights, to be able to see clearly and continue with the procedure. God being so good, we're able to do it with the experiences that we've had. And the commitment of the staff that we have, we are able to do. But it's really challenging because you have to strain your eyes to be able to do it. And honestly speaking, it's very challenging.
Although they have appealed to the Warwards Member of Parliament, Superintendent Retired Peter Lanchen Tubu, Warwards District Assembly, corporate organizations, and benevolent individuals to come to their aid, they are, however, looking at what they can do internally to fix the challenge.
You know, usually most of these things you start with in-house. We have looked at our own capacity and we thought of getting it by ourselves. However, it's a bit expensive. When we made the inquiries, I think it's over 30,000. The last one we got was around 35. That was even about 6 to 7 months ago, and I don't know how it will be now. So we solicited the support of the Member of Parliament for Wild West, and he promised, he made us get the bills of quantities for him, and he promised getting us one. Unfortunately, maybe we haven't gotten it yet. And also the District Assembly has been brought in the known. We are by this appealing to other external organizations who can come to our aid. This is a deprived community, and we have sacrificed to be here to offer the best that we can for the people. And even to be operating for this number of months without the lamp is a testament of the sacrifices that we are willing to go the extra mile to help. But we need support.
Reporting for JoyNews, Rafik Salam. Watch out.
Oh, this is quite a troubling situation. Dr. Benjamin Ameyori joins us on the phone lines now for more on this. Doc, I'm grateful that you could join us. Now, 2 years is enough a time for us to be able to fix this light. How's your asking or requesting for help been such that after 2 years, we've still not been able to fix this problem?
Hello.
Okay, Doc, I was trying to find out from you, what is really impeding our efforts such that 2 years, we've still not been able to fix this problem?
Thank you, and good morning to your viewers. Sorry, I'm not Benjamin Ameyori. I think the one who, I think I was listening, and I think the voice that came is Benjamin Ameyori, and I'm Dr. Damien, who is the Regional Director of Health Service. So I don't know whether you want to talk to me or... Okay,
no, I mean, I want to talk to you yourself, so pardon me for that mistake, sir.
Okay, so thank you once again. Indeed, this is the first time this issue is coming to my attention as a supervisor. And really, I would say that I'm really disappointed in what has happened because if the hospital has challenges like this, you expect that they will report to us even while they are making internal arrangements. Now, we haven't had that report. I spoke to my equipment unit. We have a regional biomedical scientist, who go around the various hospitals to check on, do servicing, and then routine maintenance, and also breakdown, repair of breakdown equipment. They tell me they were in Wichao 2 weeks ago to work on other equipment, but the issue of theater lamp didn't come up. So it means that they are not even, it was not reported to them even when they went there to service the equipment that they went to do. So I think that what I would say is that the leadership of the hospital did not really act well. They should have contacted us. There is a theater lamp there. So if it is not working, the first thing is to get the biomedical unit or report to the superior. Then we'll know what to do. If we can work on it, they will work on it. If it cannot be worked on, then we will all see how best we can. But when that has not been done, and then the doctor indicates that they are using
mobile phone light.
Mobile line. This, I think, is an exaggeration. This is how far from what. Expect that in lamp, you should put, if you assume that breakdown and be able to repair
so Doc, I understand that you're saying that you have one of these lamps at your disposal. When can this problem be fixed, now that you are aware of?
So there is a lamp at the hospital. What I'm saying is there's a lamp at the hospital. So if it is not functioning, what the hospital is supposed to do is to report to us first. Then we will send our medical engineers, biomedical engineers, to assess it, to see whether they can fix it. In fact, they worked on it somewhere last year. That's the indication I got. And it was working. So if it breaks down again, to report again, so they will go and check to find out whether they can work on it. Then, if it cannot be worked, then we will start looking at where do we get another one. But if that has not been done, and then you are endangering the lives of patients by using phones, which I believe is not even correct, because that will be an act of irresponsibility. You know, when there are nearby hospitals, you can easily refer. To be operating with mobile phones is unacceptable.
No, you just said that they brought this problem to you and that the light was repaired, but probably has broken down again.
So they should. What I'm saying is that they should.
Is it not the case that they have reported this to the office several times, and because they are not getting response, that's why they even went to the member of parliament of the area to help them out?
What I'm saying is that it was worked on. It worked. So as at now, I don't even know when the lamp, it broke down again. That theater equipment broke down again. If it does, you're supposed to report. But if they didn't report, we are not going to be able to know that the lamp is malfunctioning. So, we don't have any report from that facility that the theater lamp is not working.
And are you also suggesting that if that is the case, they cannot be innovative enough and work on people when it's an emergency, that they should refer when we know that every second in this situation is count?
No, it depends on the situation. You see, there are lamps. The theater inside has light. In a gross one that you can see, of course, you can do that. But where you're talking of perforation and you have to repair, it's a micro level of this. So you don't really have to risk. You can leave an item there. You can also may not be able to switch up properly, and that can bring about complications. So I am saying that it is probably not. We would. Once the story comes out, we will follow up to the hospital to find out what is happening. So
Doc, once you know now, what are you going to do now?
That's why I'm telling you that we will dispatch our biomedical engineers to the hospital to assess, find out if it is indeed broken down and whether they can work on it, because they have been working on not only that hospital equipment, but across the other hospitals. So if they can work on it, they fix it. If it cannot be worked on, then we will know what to do.
Okay. But okay, I guess you do have meetings, regional meetings, if not weekly, monthly, to understand how health in that part of the country is doing, isn't it?
Yes, we do.
But within those your meetings, it hasn't come up that this lamp has been destroyed.
Yeah, we have no information. And I think that usually we don't want this to be the first to hear it from the radio station or TV station is something that we don't really want to. So I think that, thank you for bringing it up, but we will take it up from there. But I want to really indicate that it doesn't come to our attention. And once it has come to our attention, we will quickly look at what is happening and then we'll solve it together.
Dr. Damian Punguyiri, I'm grateful that you could join us here on the news desk on Joy News. Now, moving on, and still staying in the health sector, the Minister of Health, Kweku Ajiman-Menu, says Ghana has made significant strides in improving neonatal and maternal health care delivery in the country. Now, according to him, neonatal and maternal mortality cases have seen a decline from 29% to 24%, while all other maternal health care indicators saw positive outcomes. He was speaking at the opening ceremony of the 5th global meeting of the Network for Improving Quality Care for Maternal, Newborn and Child Health in Accra.
The Network for Improving Quality of Care for Maternal, Newborn and Child Health was formed in 2017 by 10 countries, supported by WHO, UNICEF and UNFPA, and in collaboration with other partners. The network brings global and regional coordination to quality of care for countries to share their best practices and to shore up changes through coordinated evidence-based actions and joint learning. At the opening ceremony of the 5th General Meeting of the Network, the Minister of Health indicated that Ghana has over the years put in place considerable effort in promoting maternal and newborn health care, which has resulted in increased coverage in maternal and newborn indicators.
Let me say that the past 2 to 3 decades has seen considerable efforts and investments in promoting maternal and newborn health in Ghana. This has resulted in increased coverage in maternal and newborn health indicators. ANC by skilled provider increased from 96% to 98%. Births occurring in the health facility increased from 54% to 79%. And births attended to by a skilled provider increased from 55% to 79%. Neonatal and infant mortality reduced from 29 to 25 and 50 to 37 per 1,000 live births, respectively. Despite this progress, Ghana's maternal mortality of 319 per 100,000 live births raises red flags for mothers and babies receiving care. Most of these deaths are preventable, and about 65% of them attributable to 4 causes: postpartum hemorrhage, hypertensive disorders, abortion, and sepsis.
The country representative for WHO Ghana, Dr. Francis Chisaka Kasolo, said over the 5-year period, all the network countries, including Ghana, have made great progress in strengthening the health system to provide quality care in general for mothers and children in particular.
Newborn and the child health. So in this program, what we seek to do is to improve the quality of care during, after pregnancies or delivery. So in this meeting, and linking it out with the Sustainable Development Goals, especially Sustainable Development Goal number 3, which calls upon for the improvement or attainment of universal health coverage, one of the areas is really to reduce the deaths amongst mothers that are delivering, as well as the children. So this meeting, by impacting skills to the different players at the different health facilities and the community, will contribute in reducing maternal mortality and child mortality, and in so doing, improve the chances of Ghana attaining the Sustainable Development Goal, and specifically attaining the Sustainable Development Goal number 3, which aims to improve universal health coverage.
Dr. Anshu Banerjee is the Acting Assistant Director General, Universal Health Coverage at the WHO, and he iterated the importance of the network.
On 3 messages why we are here. First of all, we know that for maternal newborn health, about 50% of mortality could be prevented if we would improve the quality of care. So that's the first key message, I think. Secondly, quality of care is also an equity issue. We know that in many health systems, the remote areas don't have enough human resources. They're the ones where the supply chain doesn't work. That's where data doesn't work. Let's say we're gathering data often is a problem. And so improving quality of care has a very strong component of also strengthening equity, bringing quality services to the last mile. The key objectives of the meeting are to see how we want to move forward. How do we want to strengthen the issue of quality of care within our work, and how do we also strengthen the role of the network moving forward in order to make sure that lessons can be shared and countries can learn from each other in order to improve the lives of mothers, women and children.
The 5th global meeting, which is ongoing in Accra, is aimed at sharing the success and shortfalls of participating countries in improving quality maternal and newborn health care. Prince Kwame Kuduga's report read to you.
Now, the Finance Minister, Ken Ofori-Atta, has proposed an increment in the amount paid as road toll. This is part of the effort to reintroduce the tax policy. Now, in a memo dated 10th March 2023 to the Roads and Highways Ministry, Mr. Ofori-Atta sought the input on the proposed rate. In November 2021, the Finance Minister announced the cessation of the collection of road toll, subject to the approval of Parliament during the presentation of the budget. And he cited congestion and traffic jams at the toll booth as justification for the decision. Well, so how much will motorists be paying now? Let's take a look at the figures. So if you are a motor rider or you ride a motorbike, you used to pay 10 pesos. If this is approved, you'll be paying 50 pesos. For a saloon car, you'll be paying 1 cedis if it is approved. Pickups and 4x4 vehicles, you'll be using 1 cedi 50 pesos. For light buses, you'll be paying 1 cedi 50 pesos from the previous 1 cedi you used to pay. For mommy wagon, you'll be paying 1 cedi 50 pesos. For heavy buses, you'll be paying 2 cedis instead of the 1 cedi 50 pesos you used to pay. For light good trucks, that's trucks with 2 axles, you'll be paying 2 cedis instead of the 1 cedi 50 pesos you used to pay. For medium good trucks, that's trucks with 3 axles, you'll be paying 3 Ghana cedis. For heavy good trucks, that's 4 axle trucks, you'll be paying 3 Ghana cedis. For trucks with 4 axles, with 5 or more, you'll be paying 3 cedis 50 pesos. For agriculture tractor, you'll be paying 1 Ghana cedi. So that is the fares or the tolls if they are approved by government. Now, for Toll Workers Union, they are still uncertain about their status in the event of the reintroduction. Chairman of the union, Henry Dogbe, joins us live with more on this. Grateful to you, sir, for joining us. Now, first of all, what do you make of this plan to reintroduce tolls?
Hello, good morning.
Good morning.
Yeah, we received the information yesterday that you reintroduced the toll. But actually, during 2021 budget review by the finance minister, that the tolls will be abolished in the country, and all the toll workers will actually be reassigned. And until they are reassigned, they will be paying them monthly. But all those bargains, they couldn't actually fulfill none of it. So it was yesterday that we heard that they are bringing back the toll. So we were very happy.
Okay. Now, when the toll collection was suspended, government said you and your members will be reassigned, and your arrears also paid. Now, have your members been reassigned, or were they reassigned?
They've not been reassigned. None of us was reassigned, and they've not been paid too. Apart from the December 2021 money that they paid, that was all. So they were promised that until we were reassigned, they will pay us every month. But that bargain too, they did not fulfill the bargain. So since we didn't receive any money from the government, whether reassigned or payment, nothing like that, no compensation, nothing. So we actually engaged with some of the officers, and then we told them, if possible, they should reintroduce the toll, because right now the e-levy is not working. They promised us the e-levy, they will use the e-levy money to generate work for us, whereby the e-levy didn't work, and then we were not paid, we were not being reassigned to. So it was just yesterday that we saw it, that they said the finance minister actually released this thing that they are bringing it back again. So we're just happy.
So we're told this is something that they give out on contract. Have your the contractors who employed you, have they also spoken to you or engaged you on anything in terms of the reintroduction?
Actually, when we received the information yesterday, we actually booked an appointment with some of them. So we are now going for a meeting. Then from today up to maybe next week, we'll actually engage them and then we'll see the way forward.
Interesting. And the contractors have also not told you whether or not they've been paid by government?
No. They didn't tell us anything. We only saw it on the media. So we actually called to book appointments with some of them. So we sit and discuss the way forward. Okay. So until we are back, we don't know what is going to happen now. Yeah.
Henry Dogwe, I wish you all the best, and we'll be standing by to know how this particular meetings of yours go. Grateful. Now, moving on to other stories now. In this day and age of climate change, farming without information on when the rains will come down or when the sun will shine is such a big risk. A weather information platform launched in partnership with the Ghana Meteorological Agency is seeking to help farmers to get better decisions or take better decisions on their farms. In this week's edition of Climate Focus, correspondent Mahmoud Mohammed Nuruddin speaks to farmers driving a change with weather information.
The farmer in the Ashanti region's Ejura usually began plowing his fields to prepare them for the major season crop of maize. He needed the rains, but the region's unpredictable weather made it impossible to predict when the rains will arrive.
Over the past few years, we were affected by long dry spells and other things.
As a result, Sedu relies on GMED weather information, which is commonly distributed via social media, particularly WhatsApp. Every morning at about 5 a.m., Sedu must check the weather forecast before planning his day's activities.
You see, when you are going to the farm and you don't have any weather information, then it's like you are in a darkness. Sometimes some of the chemicals you go and apply, it doesn't need rain. You go and apply them, you come home and the rain falls on them, it becomes waste. I think it has helped a lot. It has helped.
Ejura is located in the Ashanti region, which received averagely 1,500 millimeters to 2,300 millimeters of rain per year. During the last 5 years, annual rainfall ranges between 2,500 millimeters to 3,200 millimeters. However, the area shares a boundary with the Bono East regional town of Atibobo, giving it a slightly different weather pattern. To take the guesswork out of farming in a country with unreliable rainfall, the Ghana Agricultural Sector Investment Program GASIP funded the installation of 12 satellite automatic weather stations across the country.
Okay, so the first thing we do is validation. There are man-made stations within the northern sector that have already been calibrated over the years, and so we use those as standards for the automatic stations. So we compare the data from the automatic station with the data we have from the manual station and see how the data from the two stations correlate. If you are able to standardize the automatic station to give you the accuracy the manual station will give you, then you can rely on that. So that's the first thing you do, calibrate the automatic station to meet the standard that you want. Once you get that, the next thing is to quality control the information coming from there. So if you are getting, sometimes it's just sensor, it will probably accumulate some dust, and so we'll be giving you some wrong figures and all of that. So you constantly monitor and see that you are maintaining the place, you are cleaning the sensors quite regularly, and then you are monitoring the data to see that every data you are getting from there is something that is realistic. You don't get any temperature value and just feed your models with them. You validate and see that every data you are getting there is what you should rely on. So that's what we're doing to make sure that we are getting the right data to feed our models for forecasting.
Your body rests, your money rests, and all that.
His colleagues Abdul Gafar Osman and Suleiman Abubakar were in the same boat. Both have lost money in previous seasons.
Last 2 years, for instance, in fact, in terms of monetary, I can say I lost about 12,600 rather, because I plowed my land and I planted, and I have to do the spraying. We had some weeds here, which locally we call it adanko milk. That adanko milk, in fact, if you spray it and you're not lucky, it will not work. Especially immediately you finish spraying, if it rains, it won't work. I had that problem. I have to replow the land again and plant. I did, in fact, still I have to go for the third time, because then time I did not know, we were not given the update. So I did not know that the season, the rainfall pattern is small. So I went into it. At the end of the day, I didn't get anything.
Looking at the time I wasn't on the platform, I only see rain and go and farm. There is a season whereby the way the rain blade, when it comes, we feel it will go far. We went and put all our monies and everything. Later, it couldn't go far. But if it were to be today, the platform will update me. This rain is going far. It's not going far. Don't do it.
But now that they have relied on Seidu for weather information from GMET, they say they plan their day well.
Farmers say weather information from GMET is now improved. They can now save time, energy, and resources. Know when the rains will come, and the rains will not come at all. So they can now plan their farming activities very well.
Decision, the right time to plant, right time to plow, right time to do your spraying. Some time back, we used to buy chemicals, spray our farms, then the water will come and spoil everything. Because if you spray and it didn't take some hours before it rains, you have to spray again. But since we started getting the updates, it helps because it will tell you when it will rain. So you also have to take your own decision, the right time to spray, so that you will not run at a loss. So it helps a lot.
But currently, the platform is helping me a lot to know when to farm farm produce. It helps me to plan well. But in the olden days, you may see the rain raining, you may feel that the rain will go far. You go and plant your plants, you do everything, the rain will stop. But currently, the platform, the way it's effective, it is helping me a lot in my farming.
Very useful, not to me alone, and to farmers. Some of the farmers that are in contact with us, it is very useful. Sometimes people used to call me in the morning and ask, Charlie, how is the weather going to look like this morning? It's like I've become more or less their weather guide. You get me?
Usually use the local language. Some of my friends speak Hausa. I use Hausa to tell them. Some speak Twi, others speak Mampurli, Dabani, and the rest. I try to tell them so that they also take advantage of it.
One of the challenges of GMET over the years has been getting the message directly to those who use them, particularly farmers. According to GMET meteorologist Joshua Samoa, most farmers are uneducated, making it difficult to get the message to them.
Now, the River Brim is drying up. From what our cameras captured, it looks like the fight against Galamsey is being lost. Now, residents say excavators are ahead in the forest each day, destroying cocoa farms in their wake. Now, this is what my cameras captured when I visited a Galamsey site in the Kwai Brim municipality.
Deep in the forest, somewhere in the Kwai Brim municipality of the eastern region, illegal miners work till their equipment give up. They destroy cocoa farms and palm plantations in search for gold. This is a cocoa plantation in Abakan. It's a community close to Kede and very near the Birim River. Now, the cocoa trees are being cut down by illegal miners. Now, if you can see right behind me, there's a pumping machine belonging to these illegal miners. There's a gallon. Now, what we've seen here indicates that these people were mining some few minutes ago, but just when they heard that the police is heading this area, they bolted, leaving their machine. We've seen the excavators that they were using to do this. Daniel is the son of a farmer whose cocoa farm has been destroyed.
On the 5th, on my friend on my car said, "Nkrofa by assassin." So, they knew it. They may buy 5th on the 6th. A Monday, no, and I may buy site. May buy and pamper 2 machines. Me, no, site.
I traveled with my father and returned on the 5th. Some people informed us that some galamsees have invaded our land. So I came here on the 6th to check, but didn't see anyone working, despite their machines being here. The following day, I brought the CID officers to pick them up, and they won't stop working.
He says the illegal miners continue to operate despite several warnings from the police.
They didn't heed to the warning, but they continued. That's why we have brought you here.
Kojo Oforiata is a lawyer of a cocoa farmer who has been affected.
I think seeing this is quite sad. I mean, we all have witnessed what we are seeing here. Quite sad. What I would suggest that since individual fights in this menace will not solve the problem, the community has to come together with the backing of the law enforcement agencies in the community, the police, the national security, the DCE or the MCE, so that they will make sure that this natural resource we have. You know, we have cocoa and other oil palm even here. It can be protected well. Other than that, we are destroying our own river. You know, Brim is just behind what we can see here.
So, as we say, in a country that is the second largest producer of cocoa, if care is not taken, Galamsey will push the country off that perch. Because today, in every nook and cranny where there is a possibility of finding gold, Galamsey don't mind cutting down cocoa trees just so they could have access to gold. This is in Kede, around the Birim River. But the river itself has been so polluted, it looks so muddy, and nothing else can be done in terms of it supporting human and plant life. From Kede, for JoyNews, I am Samuel Kojo Brace.
Now, South-South migration constitutes more than 70% of human mobility globally, yet it is not given much attention in both policy and academic circles. The UKRI Migration for Development and Equality, in collaboration with the Center for Migration Studies at the University of Ghana, had a regional conference to provide an avenue to harness the benefit of South-South migration for socio-economic development. The project seeks to translate knowledge and ideas into policies and practices which will work to improve the lives of migrants, their families, and the communities within which they live. There's more in the following report.
UKRI Migration for Development and Equality, MIDEC, in collaboration with the Center for Migration Studies at the University of Ghana, are working together to provide a platform for project partners, policymakers, and civil society groups in Africa. The project aims to understand the relationship between migration, development, and inequality. Director for MIDEC, Professor Heaven Crowley, shares the benefits of migration and how countries can harness them.
We know that migration contributes to development, both in the countries that migrants go to, but also, of course, in the countries that they leave. So, for example, they send remittances home to their families. It means that kids can go to school, people can build their houses, they can gain additional skills. The problem is that we have a very negative migration narrative in almost all countries in the world at the moment. And what that does is really undermines the potential of migration to contribute to development. development. We hear very little about migration from the perspective of urban development or rural development or these other policy areas where migration has a real significant impact, but also potentially a driver. So what we'd like to see is that rather than migration policies being limited to migration, we see migration as part of a broader process of socioeconomic and political development, of transformation, and that in order to really harness the benefits, you have to mobilize policies in all of these different policy areas.
Director of the Center for Migration Studies at the University of Ghana, Professor Mary Senchana, says government needs to put in place laws that will protect its citizens against exploitation.
The Labour Department needs to be proactive, needs to supervise the activities of these companies to ensure that our women are protected, to ensure that our men are protected. It's sad as if they are giving you job, but now instead of applying, you have to be recommended, and so there are a lot of youth are being left out of that. So we need to create jobs. Once we are satisfied, we have laws that give us priority. So for instance, we are supposed to do the retail sector, trading, we don't have migrants there, but we find tensions. So that means that somebody is maybe not doing his or her work well. So we need to ensure that the citizens are having access. And when it comes that way, I mean, that jealousy of, or maybe that complaint about migrants are taken out is everywhere. But it becomes more when we ourselves as citizens are also not enjoying and not seeing the enabling environment for us to succeed.
Yes, we're watching Joy News Desk. We'll take a quick break. We'll be back with business. Stay with us.
Hi, good morning. Welcome to Business. My name is Darryl Kwal. Excuse me. Now, 6 years after the maritime boundary dispute ruling in favor of Ghana, the country is here to realize the full benefits of the ruling by The Hague. Ghana and Ivory Coast were in dispute over the exploration of hydrocarbons in litigated areas. The president, Nana Akufo-Addo, made the disclosure at a ceremony to open the National Honors and Awards 2023. Let's take a listen to him.
The judgment of the tribunal has brought finality to a maritime boundary dispute that had been extant for over 5 decades. Although the precise economic impact has yet to be conclusively established, what has emerged quite clearly is that our western maritime boundary remains intact. Indeed, many were those who feared that the outcome of the judgment could strain the friendship that exists between Ghana and Côte d'Ivoire. On the contrary, thanks largely to the spirit of understanding and accommodation exhibited by that great African statesman, President Alassane Ouattara of Côte d'Ivoire, it has rather strengthened the bonds of cooperation between us. Indeed, we now have a strategic partnership agreement called the Partenariat Stratégique with Côte d'Ivoire, negotiated by President Ouattara and I.
Well, the National Honors and Awards 2023 was to recognize the efforts of individuals and organizations that supported the country during that maritime boundary dispute at The Hague. Also to recognize the contributions of individuals and organizations towards the fight against the COVID-19 pandemic. CEO of the multimedia group, Kwesi Chum, was celebrated. Also recognized was accounting and auditing firm, KPMG. Here's Senior Tax Manager, Anthony Sapong.
The COVID-19 pandemic was such an attack on both the country and world level, which impacted the survival of humanity and each individual and families. And for us as KPMG, we will always believe in giving back to society and actually leading in times of crisis and difficulties. And therefore, we put in a lot of sacrifices, volunteered people to make sure that the structures that were put together by the state and private sector, we supported them to make sure that we deliver at least relief to Ghanaians. And for this reason, this award that the President and the nation is offering to KPMG, first and foremost, for all of us to live in.
Apart from the donations you made to the presidency and the government, there were also some services that you did which were on pro bono. If you want to monetize some of these services, how do we call the kind of contribution that you have done?
Well, so in terms of the areas that we covered, there were 4 major projects that as KPMG and our resources we used. First was the Feeding the Kojo project, which was feeding the poor and the street and the homeless for the first 2 weeks of the lockdown. So we supported with the accounting as well as the distribution of meals. The second was also supporting with disbursement of meal coupons to frontline workers, which we supported in terms of accounting resources. And then the third one, which was also major and foremost, is the construction of the first infectious disease center in Ghana. So again, we acted as the reporting accountant, supporting the project, managing the project risk to ensure that it was within budget and also in completion time. And then the fourth one was also supporting the National COVID Trust Fund with organizational setup and administrative support. So in all, although we provided human resources and time, we believe that our contribution overall may be in a range of about 2.5 to 3 million Ghana cedis.
Well, President Akufo-Addo commended the individuals and organizations for their contribution to the fight against COVID-19 pandemic, saying it's an example of what we can achieve as a country when we come together. Here's more in this report.
Despite the challenges faced over the past 3 years during COVID-19, many have gone above and beyond to lend a helping hand in recognition of their selflessness and dedication during the unprecedented challenges of the COVID-19 pandemic. President Akufo-Addo has awarded a group of exceptional individuals for their heroic efforts in supporting communities through the crisis, from healthcare workers on the front lines to volunteers delivering food and supplies to those in need. President Akufo-Addo says these individuals served as an example of what can be accomplished when we come together in times of crisis.
Scientists, advisors, public health managers, frontline healthcare workers, hospital staff, contact tracers, the security services, public and private sector agencies, faith-based organizations, chieftaincy institutions, charitable organizations, and so many others who dedicated themselves to the fight to keep Ghanaians safe. That is why we're here today to express our sincere appreciation and gratitude to all these segments of our population.
In the award category of the Order of Voter Companion, the President celebrated core members of COVID-19 National Task Force, trustees of the COVID-19 Private Sector Fund, and the ITLOS legal team, as well as other individuals nominated for special awards in recognition of their heroism in the fight of the pandemic. The President hailed the success of winning the maritime boundary dispute against Côte d'Ivoire.
The judgment of the tribunal has brought finality to a maritime boundary dispute that had been extant for over 5 decades. Although the precise economic impact has yet to be conclusively established, what has emerged quite clearly is that our western maritime boundary remains intact.
All right, and that's it for business. Brace will be here to wrap up. Stay with us.
And that's how we wrap up today's edition of News Desk. We'll bring you our Ghana Month story in our news, JoyNews today. For more news, log on to myjoyonline.com. My name is Samuel Kojo. Thanks so much for your attention. Good morning.